on this the tab that's section 5 to 6, column L deals with total live births. And as we did before, if we wanted to sort that, we'd click the triangle in the upper left. We'd go to sort. We would sort by the total number of live births, largest to smallest. And that would tell you, again, Sharp Mary Birch Hospital comes at number 1. And then if I was interested in the number of C-section births, I could do the same thing and sort that column, which we can do, and see who's performed the most C-section births. And again, Sharp Mary Birch was number 1, but there was some changeover in some of the other facilities that were below it. So for me, I'm now interested in understanding what percentage of the births were C-section births. So what I want to do is insert a column in the data field. And to do that, you could put your cursor on T and highlight column T. And you could insert a column. To do that, you would right-click over column T and go to Insert. And you see that it's inserted a column. Now, you would not want to do this in this chart, which is the chart which has the pivot selection pages, because by doing that, you will ruin all of the pivot data. I did that over the weekend. It then makes the data unusable, and you have to start again. In this case, there aren't formulas that apply to this data. Each of the data cells relates to a number and not a formula. So you'll want to put on top what it is that you want to do with this data. And you would put C-section percentage. And that's where you'd begin to use formulas. And it's really important that you understand the proper formula to use when you're looking for something, because if you enter in a formula incorrectly, you will end up with wrong information. So percentages and percentage changes sometimes throw folks off, so we'll take this slow. When you put a percentage in a field, you want to start it with equals. And then you want to select what you want as the top figure in the percentage. And in that case, we're dealing with C-section births. You can either click the cell, or you can type the cell number in. So this is S3. And then I want to make that over, which is the slash. And I want to make that over the total number of births, which is L3. So I would pick, either type in S3 or click S3, and then hit the slash. And I would either type in or click L3. So that's telling me the percentage that C-sections make of the overall births. And then you would hit enter. This is calculated as a decimal point, but you can convert it to a percentage. But for now, if we want to do that for this, we could either start again and do equals and pick the cell and slash and then pick the other cell and hit enter. But you also can do you can click on this and drag the corner. Let me start here again. So you've identified the cell by just clicking on the cell. You then go to the corner and you notice a cross. And you can click on that cross with your mouse and drag it. So I'm dragging the box down. And what that's doing is it's populating the formula into each cell. Excel is pretty smart. And if you use a formula, it will duplicate the formula. But it's important to check and make sure it got that formula right. So here at the top, I'm seeing it's S5 over L5. And in fact, that's the formula I wanted. So I'm going to go about continuing to drag this down all the way to the bottom. And you'll notice that in some of these columns, you'll see that it can't calculate it because you're dividing 0 by 0. And so it gives you sort of an error message, which is OK. That's because they're not delivering babies at those hospitals, in case there was that was in doubt. OK. So now in this case, now that we've identified all of the columns, what you would want to do is right-click. You would want to highlight the entire column by clicking on T. And by clicking on T, that will highlight the entire column. And you'll want to right-click and go to Format Cells. Format Cells lets you tell Excel how you want to view the information. And when you click Format Cells, you can click Percentage. And it will take it to 2 decimal places. And I'm hitting OK. And you've seen what happens here. It changes it to a percentage. So now if I'm interested here in totaling it and seeing which hospital has the highest percentage of C-section births, what I want to do is highlight all of the data, as we've done before, go to Sort at the top, C-section percentage, largest to smallest, and then I would hit OK. So the first ones it's going to put at the top are those dividing 0 into 0 and those error messages. So we'll scroll down through the error messages until we actually hit a hospital that delivers babies. And the first one we'll see is Kaiser Hospital, Santa Clara, where 72% of the babies were delivered by C-section. That's a really high number, and it could well be that Kaiser Santa Clara tells you that the data is incorrect, although as I mentioned to you, they submitted this data to the state, but it still could be incorrect. And if that's the case, then you should alert them and tell them that they should really correct their data with the state. But it's also possible that it is correct, and they just have the highest C-section rate in the state. And I would want to ask some questions about why almost 3 in every 4 babies are delivered by C-section there when the state average is considerably lower than that. Does that make sense? Let me stop for a second there. And Barbara and Michelle, are there questions relating to this, or do you guys need me to repeat anything?
Okay, I'm looking right now to see if anyone has raised their hand. Okay, I'm seeing that Anna Gorman has raised her hand. I'm going to unmute you, Anna. Go ahead and ask your question.
Hi, Anna.
Hi, can you hear me?
Yep, I can hear you.
Okay, great. You just said you can compare it to the state average. Can you explain how you do that?
Sure. So for the state average here, what you would want to do is as you go down to the bottom, what you're able to do is you can total, you can add a line where you would total all the counts for all of these hospitals. Let me show you how you could do that. You would go to this, in this case, 507, and you would put your cursor on 507, as I've done, and you would right-click and go to Insert. Insert has inserted a line here, and now what I want to do is total up the column. So I want to total up live births, which is column L, and what you can do, total, you have 2 different ways of doing that. You can go to the home screen, and there's what's called auto sum. And what auto sum does when you click it is it's telling you it's summing up, adding up L2, which is the first cell, to L506, which is the last cell, and the colon is the range. So it's adding all of those up into one, right? So I'm asking it to sum up all of the births in the state and tell me how many births in the state total were there in 2009. You hit return, and it comes back and tells me there were 514,000 babies born in California hospitals in 2009. Then you can go back to column S, which is your C-section rate, and do the same thing. You would hit auto sum. It would go from S2 to S506, and you would hit return. So it's telling you that there were 158,677 C-section births in 2009. And then you can go down here and take that formula and drag it one more cell, and it will show you here that the C-section rate in the state of California at hospitals in 2009 was 30.8%. Now there's a couple words of caution on this sort. If there is a blank line anywhere where something is not filled in with a 0, the sort will stop. And so if you said go from S2 or from L2 to L506, but L100 wasn't filled out, you will not get a proper total. So it's really important that you make sure that the parameters are exactly as you want them, because that could really mess you up and make sure and ensure that you're not getting the correct information. So you may want to run this by, if you have questions about this, you may want to run this by Ashbid and make sure that your numbers, in fact, match theirs. And they're really good at doing that. You can run this by them and say, I've used your data tables, and I want to make sure that this is correct. Now, Anna, you could also go to the pivot tables, and you can look up the total for births, and let's hope it matches. So let's go to the pivot tables, and let's go to the pivot selection page, and take away our contra cost accounting and go to all. So that should be all hospitals in the state. And we go to the profile summary page. I'm really hoping that this matches up for the total number of babies that were born, and if not, maybe there's an issue with OSHPD, but it's 514,690, and let's see if we go to this other one, 514,690, great, I did it right. And then the number of C-sections 158,677. If you go to the pivot table, you would see 158,677, 30.83. So you may be better off summing it up using the pivot profile pages for all hospitals in the state, but you can also do it using this overall one. And then that helps you put this into context. So these hospitals that are up here that are performing, 1.5 to 2 times or more the percentage of C-sections compared to other facilities, you would want to know what it is that's going on there. And I would have some serious questions for those hospitals because it is unlikely they will be able to explain that away based on the patient characteristics of patients that are coming to their facilities. And they should know that this is an issue, and if they don't, I would have some major questions for them. Does that make sense, Anna and others?
And I've just unmuted you again.
Yes, thank you.
Okay, great.
And then we have another question, Charlie.
Yeah.
Somebody, Philip Gratzer in Atlanta public radio station, wants to know what kinds of agencies in the state maintain the type of data that OSHPA does. Are they state agencies or hospital associations? Where does he go in Georgia to find something like this?
So they may be either state agencies or the hospital association. I think what I would be inclined to do is call your state health department and ask where the sort of data warehouse is. In the tip sheet that I put together, which I will show on the screen here, I gave a couple examples in various states. So in Texas, it's called the Center for Health Statistics. I'm going to click on that just so you can see the website for it. And they have various information and various surveys of hospitals, data collection and reporting. In Pennsylvania, there's another, the Healthcare Cost Containment Council, the phc4.org, and that will give you information as well on hospitals. So I think you just need to ask your state who gathers the aggregate information about hospital utilization and financial information, and how do you get access to it. In some states, they don't make it public, and so I think you just need to ask and find out. In most states, though, information like what we've been talking about is public. You just have to ask the right place for it.
Okay, I think that's it for our questions for right now. So I don't know if you wanted to, we have about, a little under 15 minutes, go into one other area, Charlie?
Sure. So I wanted to just to show one more, and that would be the patients who leave a hospital without being seen, and how we can determine which hospitals have the greatest number of those. And so why don't I hang on here. Let's see here. So this is the total number of emergency visits, and there should be here a field for left without being seen, but we can go to data and sort and figure that out. Which field? Actually, we can better to go to the actual to the form and take a look and see which field that is. So if we go to the ER